Good morning. We are going to discuss some various aspects of cancer today. For that, we are happy and grateful to have some eminent doctors from Sree Mookambika Cancer Center. Firstly, we have with us Dr. Pradeep, HOD, Nuclear Medicine, Dr. Chandramohan, HOD, Surgical Oncology, Dr. Sreejit Nair, HOD, Medical Oncology, Dr. Jayakumar, HOD, Radiation Oncology. Now let us move on with the questions. The first question is for Dr. Chandramohan sir and Dr. Jayakumar sir. What role does mental health play in cancer recovery?
Thank you for asking me the question. It's a very important question as far as a cancer doctor is concerned. Actually, as you have asked, the mental health plays an important role, because one of the treatment for cancer is your immune system. You have to have your immune system ready to take up this agony. Okay, so if your mental health is perfect, the drugs or the treatment which we give will act exactly the way which we wanted to do. On the contrary, if the patient is so tense and if the family is so tense, for each thing, they think twice and they discuss with many people, and then their immune system will take a break, So your treatment will be not as effective as a normal person. For example, two persons coming to me with for example, a breast cancer, One patient has a strong mental health, the other patient is very tense. The same stage treatment, the same medicine she give to the first person will act better. She won't have much complications of treatment, as well as the response treatment is much better when the mental health is sound, she is sound. Whereas the tense person, the same medicine, the same treatment which she give, they will have a lot of reaction, they will have confusion, so many problems happens in between. So that's an important aspect of treating cancer.
Fasil, I like to ask you a question back. You are appearing for an examination and there are two candidates. One candidate is mentally stressed, another person is mentally cool. Who will be getting more marks in the exam?
Obviously the person.
Yeah. So that matters here as well, because cancer is like an enemy. It attacks your body, and the attack about backing cancer by the treatment as well as your body is like defending your territory. So suppose you have an army of people who are well motivated, he knows about the war, and well equipped also. They will be winning the war. Like in cancer also, when a person is very cool, he knows about the disease and he can fight cancer in a better way. And moreover, there is a strong connection between mind and body. As Dr. Jayakumar sir rightly pointed out, the immune system is activated when patient is at best mental state. And because of the two reasons, the person who is mentally cool will be winning the cancer fight. And one more thing to it, in order to be cool, the person has to know about the cancer. So it's very, very important to teach the patient about his cancer, treatment modalities, and how are the treatment modalities going to attack cancer. So well-informed patients will be mentally motivated patients. So we have also seen that people are well educated. They face the cancer in a better way. For example, doctors. So I know many doctors, my colleagues from Regional Cancer Center, who had an unfortunate experience of getting cancer, but all of them did good because the better knowing of cancer. At the same time, if you get a cancer and you don't know much about the therapy, you don't know much about the side effects, then the patient may not be realizing that he is cured of cancer, even after cancer therapy. So it's very important to have mental health, very important to have the knowledge about cancer in fighting cancer.
Thank you, sir.
So Chandramohan sir, this question is for you. How close are we to find a universal cure for cancer, or is that even a realistic goal?
Pranav, that is an excellent question. Now, compared to our young age, you are in a very fast developing world, and the scientific advances are so much, it is unprecedented. The way things are moving at, the way we are understanding various things, the artificial intelligence, the digital technology. And one thing which happened during my tenure in cancer, because I've been working in cancer for the last 25 years, and compared to my earlier days to present day, there's a lot of understanding about cancer. So we used to think each cancer separate when we started our career long back. The head and neck cancer was different from lung cancer, was different from stomach cancer, from different from breast cancer. But now what happens is slowly the scientific world is exploring into the origin of cancer, and it's all cancers are genetic diseases at cellular level. So instead of doing a big operation and removing big tissue and causing deformity, or giving radiation, or bombarding the body with the chemotherapy, so why can't we put some small pills which have some genetical drugs which can go and manipulate and correct it? So slowly, a lot of technology has come forward. For example, the discovery of circulating tumor cells, the genetic manipulation, cancer vaccines. So these all point towards a remedy for cancer, and I am absolutely sure that within near future there may be some universal cure for cancer, because all the borders of cancers are merging now into a single entity which is genetically caused. So it's going to be a very fast achievement, and thank you for the question.
So this question is for Chandramohan sir, Sreejit sir and Jayakumar sir. What advice do you give to patients newly diagnosed with cancer?
Thank you for the question. The answer is not a very simple one. What matters is once somebody has made a diagnosis, it's like a hammer hitting upon the head. There are a lot of components in it. One is the mental aspect of it. Number two is the psychological aspect. The third is the financial. The fourth is logistics. It's going to be an interplay of all this, and you need an optimum support of each of these to get an ideal treatment. Something more I would like to tell you is, we should never go window shopping. The more opinions you get, the more confused you become. So ideally, once you made a diagnosis, the physician has already given you the staging and all the workup has been completed. The next option is going for correct treatment. The correct treatment could involve a combination of surgery, chemotherapy, radiation, and amount of psychiatric counseling too in case of a need. Now, the duty of the patient is to have a healthy interaction with the physician concerned. He may have a lot of questions, and these need to be answered. And probably my colleagues sitting around here will enlighten you on the matter.
So, Fazil, that's an important aspect of treating a patient. First of all, what I do is I call the patient as well as their close family members. I will explain the whole thing about the cancer, the type of treatment which they are going to face, as Sree sir said, the financial aspect, how family should support them, everything I will discuss. Second thing is, I will not make them panic. The moment you know that you have a cancer, the whole family, the patient, everybody will be shattered. So I'll make them comfortable. I'll make them sit with me for some time. I will talk to them about their family matters, their relative matters, etc. other than the cancers. Then slowly I will tell them that you have a small problem with you. I don't even use the word cancer initially. You have a small problem with you. You have undergone some test which is found to have been cancerous. So there is a lot of treatment available now. Unlike previously, the treatment is also complicated. Now we have to have some simple treatment which will make you cure. You will have a normal family life. Only thing is, whatever advice which we give, you should follow. That's very important, So if she is going to have a surgery, then I will tell you that you have to, that small area of your cancerous part has to be removed. Nothing will happen. Or if she wants to have some radiation, I will again tell them, it's a simple procedure with a lot of newer modalities. You won't have any side effects from that. Or if she is going to have if they are going to have a chemotherapy, so that is the drugs which we give, that will not harm you much. Some temporary difficulties may come to you, but it will not be long lasting. The moment we stop our treatment, You can go back to your office or whatever work or school, whatever it is. And I even tell them that during your treatment also, if you are working, you can do that work as usual. And your food habit, everything I will explain. So I will make them comfortable. I will not make them panic. So I will discuss all this with their relatives, and then only we start. It will take, I can't do it in a single day, 1 or 2 sittings, they will have to be with me, to counsel them regarding the treatment, its side effects, everything I will explain. Like that only we go.
Fasil, a very good question once again. Thank you. And in fact, Dr. Jayakumar and Dr. Srijit has very accurately replied to your question. And just I like to add some more points. So simple word cancer means nothing for a doctor, because there are cancers, even after diagnosis, the patient can survive another 25 years without any treatment. At the same time, there are cancers, even if you treat well, this patient may not be alive for a few months. So first of all, the counseling depending upon the type of cancer, which is accurate diagnosis. And secondly, you also have to understand the patient's educational status, understanding power. And it's very important, as we discussed in the beginning regarding the mental health, we have to teach the patient, and that teaching will never be stopped by single session. So it should be continuous counseling for the patient. We have a counseling department. So if you go to the best hospitals in the country or world, you'll have separate counseling departments. So according to the education status, knowledge of the patient has to be taught about his particular cancer and its chance of cure, the treatment modalities and the treatment complications, as well as the expenses. And it is very important to assure the patient to tell them that this cancer may be harmless. But suppose it's a villager who is coming from a village, not educated. If you assure him too much, he will go back. So it's a balanced counseling. Knowing the cancer, knowing the patient, doctor has to execute it. And one thing I like to tell, many times even if we explain everything in the first counseling, the patient will again come back and ask another person. For example, Srijit sir might have seen the patient. He might have told everything about the patient. Next day he will come and ask me, sir, there is a patient. Srijit sir told so many things and we could not grasp it. It's correct, no? Patient is so stressed with the cancer diagnosis and may not be having good grasping power, tensed, and he may not understand correctly. It's very important to repeat, re-educate, tell again and again and again about the cancer and treatment. And many times it may not be possible to doctors. So in most hospitals there are counselors who are available to interact with patients. Sometimes patient will have a silly question. Once I remember a patient treated by Dr. Sree sir in RCC Trivandrum, and well explained. He took care of the patient, well explained, told everything about the patient. But one patient was again came to me and asking, sir, one thing I am not very sure is how to have my social life, because I am in Trivandrum. My wife is in Cochin, and shall she get a transfer to Trivandrum to look after me, and how long it is going? So the questions are umpteen, and a single doctor cannot answer that. So its communication has to be continuous through the treatment. Otherwise, patient will be in real misery, and the cancer treatment may not achieve the correct objective. Thank you.
The next question is to Dr. Chandramohan and Dr. Pradeep. What are some important lifestyle changes people can make to reduce cancer risk?
Environment and lifestyle and development of cancer, because cancer develops closely related to the environment in which we find ourselves, as well as the environment we sometimes create for ourselves. Environment in which we find ourselves, by that I mean things like pollution and all that, about which we don't have much control. Although traffic regulations and all that are bringing down the air pollution, the air we breathe. Yeah. Now, we make for ourselves certain bad environmental and lifestyle changes. One is importantly tobacco. Almost everything about tobacco is bad, I would say, from the oncology point of view, cancer perspective. Like chewing tobacco, smoking tobacco, putting it somewhere in your mouth and not doing anything, it will produce a cancer there again. Smoking is a well-known example. Smoke from tobacco, smokes from the cigar or cigarette goes into your lungs and produces cancer in the lungs. It's not a good disease to have, lung cancer. Chewing tobacco. The fun part of it is keeping it in the mouth for a long time, so that you get the stimulant effect of tobacco. That causes cancer in the the mouth, throat, everywhere. So alcohol and tobacco, they add to each other. Like not only alcohol goes to your liver and other places and causes trouble there, but later on may become an incurable liver cancer and all that. If a person is in the habit of using tobacco, in addition to alcohol, the effect is additive and sometimes super additive, like going above the additive effect of tobacco, effect of alcohol, add them together, cancer is more than that really. So it has to be curtailed. Even the courts have recognized that in India and they have prohibited public smoking, public chewing and all that. Nowadays you don't find much of smoke, and I told you about passive smoking. If you smoke a cigarette and you exhale the fumes, the person sitting next to you is as good as smoking himself. That is a bad thing too. So this is a very important lifestyle change everybody can make. That's what I meant by saying the environment we create for ourselves. Smoking is unnecessary, we don't need it. But we still have a sort of psychological desire to smoke and get a sort of, cool down using a cigarette. It's a bad thing to do. Another factor which everybody says these days is obesity. Look at me. Obesity means if you have a lot of weight, that's a storage of fat in the body in unnecessary places. Apparently this is connected with various kinds of cancer. We will discuss that maybe later on. Controlling obesity, eating kind of food you eat, like fatty food, reduce that. High fiber food you take, that's good for your colon, intestines I mean. So this kind of change in diet which you take, food which you take is also absolutely important in preventing some types of cancers and delaying some kind of cancers also. Then hygiene, very important. People say brush your teeth, clean your parts, clean your body, keep yourself clean and all that. It's hard to understand why it should be done every day, like children especially have trouble obeying this personal hygiene rules. Like some of the cancers are now become so low, like I would say cervical cancer. I'm sure we'll be able to explain it later on. So keeping all this in mind, these are all lifestyle changes which we can make to improve our chances of escaping this bad disease.
Thank you, Kevin, for the excellent question. Dr. Pradeep sir has answered it very well, but I like to just add up some points. So when you look at the cancer, again, I like to tell it's a cellular level, genetic disease at cellular level. And why this genetic disease is causing and genes are behaving abnormally, it is because of two reasons. Number one, the genes are abnormal from the beginning itself. That happens in 5 to 10% of hereditary cancers. And remaining 90% of cancers, it is changed by either environment or your food or your life habits. And of course, hygiene as well. So the ideal lifestyle which is good and useful to prevent any disease, it is useful for cancer as well. There was a lot of emphasis for people having bad habits, drinking, smoking, getting alcohol. And based on that factors, we used to think that all cancers originate from bad habits only. So that's why when we have a National Cancer Control Program in 1970s, the first thrust was to control tobacco use. So that's why a lot of legislations came in. Tobacco was, you won't see people smoking cigarettes in many parts, at least publicly. But even then, the cancer rates are not decreasing, still increasing. So then we have to concentrate on other factors. So regarding the genetic, so what can you do about that? The one important cause for the genetic cancers, for example, there are breast cancers, some gene mutations, is consanguineous marriages. So if you can avoid consanguineous marriages, which may be existing in our society, because one person maybe one partner will be carrying the bad gene, it has to be neutralized by a normal gene from other partner from not genetically related. When you have both partners are genetically related, you have the most chance of getting that genetically mutated cancer gene in your child's body. And the second is the diet and exercise. Pradeep sir has rightly pointed out obesity, lack of exercise, contributing to not only cancer, diabetes. The type 2 diabetes is a completely preventable disease. So now at present, 10 to 12% of the public are having type 2 diabetes. So had they exercised in the beginning, had the diet control, none of them might have diagnosed with diabetes. So similarly, the cancer is also can be prevented by diet, good diet as well as exercise. Exercise also we see that it's not a habit among us. If you go to other walks of other societies, you see it's a normal routine for every citizen. But we don't see many people exercising in our society. So that's an important thing. And of course, hygiene. Because the best example is cervical cancers, which is caused by HPV virus. And of course, it is related to the poor sexual hygiene, maybe the genital hygiene. So it's very important to keep the hygiene as well. So in short, we can summarize genetically avoiding consanguineous marriages, a good lifestyle, a balanced diet, and good personal hygiene. And avoidance of other risk factors like sunlight, maybe radiation. So this pretty much summarizes the cancer prevention strategies.
This question is for Chandramohan sir, Jayakumar sir and Sreejit sir. Have you ever observed any trends in cancer rates over the recent years?
Yes, there is definitely a change happened during the recent years. When we were student, we used to have cervical cancer. That was the number one in female cancers in Kerala and in India, all over the world. Now we don't see any cervical cancer because, as previous speaker said, the hygiene, the personal hygiene, the environmental factors, as well as there is a vaccine now. So that has totally taken off that cervical cancer. You do come across cervical cancers once in a while. On the contrary, among the females, breast cancer has become the number one. As said, lifestyle changes, their hormonal status, marital status, everything contributed to increase in number of breast cancer, as well as early detection. Now people are quite aware that this disease is there. So breast cancer is on the rise in the females, whereas the cervical cancer almost getting disappeared because of the newer diagnostic tools and the reasons for the cancer. Similarly, for men, previously people used to chew lot of, and also smokers were very high. So we used to have lot of buccal mucosa, oral cavity, throat cancer, etc. were in the high. Now the chewing habit has come down, buccal mucosal cancer has also came down. Similarly, lung cancer is almost same. And rectal cancer, that is the colorectal cancer, that is cancer of the colorectal cancer, rectum and colon, large intestine, that is on the rise. We don't know the reason. Probably because of the food habits. Now people take a lot of junk foods. We take a lot of red meat, and all this red meat you have to fry again in oil. That will add probably one of the reasons for increasing rectal cancer and colon cancer. And these diseases are there for both young persons as well as older persons. Similarly, for ladies as well as gentlemen, this kind of cancer is on the rise. So definitely there is a trend, like colorectal cancer is on the rise, GI cancer, that is the stomach cancer, is on the rise, whereas the buccal mucosal cancer is slowly coming down. Like that, breast cancer is on the rise, whereas cervical cancer is slowly going on. So there is definitely a change in trend of cancer detection as well as the diagnosis of cancer.
Yes, sir.
Okay.
Sir, so the rate of cancer right now, how is it?
Yeah, that's a good question, and Jayakumar has also answered a majority of that. But there are certain other facts which you should. Certain habits are also coming down.
Yeah.
In parts of Kashmir, you have got what is known as Khangri cancer or Chutta cancer. What is Khangri cancer? It's very cold in those areas. So beneath their costume, they used to put coal, which is kept in a pot. That leads to local irritation, and you get a squamous cell carcinoma there. And there's something known as an esophageal belt. You heard of it? No. It starts from the southernmost Iran, Indo-Gangetic plain, and goes up till Shanghai. Because you have a lower end of the esophagus, or sometimes mid one-third of the esophagus are involved. Question is why? The answer is very simple. From the Iranian border to the borders of Kashmir and Indo-Gangetic plains, people are in the habit of drinking very hot tea in copper kettles. It's brewed in copper kettles, right? But as we pass downstairs, go to the Shanghai, and there they used fish that has been smoked. So basically all these things are adding to a geographical phenomena whereby esophageal cancers predominate. Only by a proper education can you come down. In India itself, there are places where you find high incidence of nasopharyngeal carcinoma. It's in the northeast, right? Mizoram. And there are even certain specific districts where the incidence is very high. Next, there is something known as the Chuta cancer. Ever heard of it? In Chuta cancer, people have the habit of reversing the burned end of the cigar. And in places like Andhra Pradesh, where the intake of chili is very high, they do have a high incidence of stomach cancer. So in addition to a reduction in the rate because of this, these habits too imply, implore, and ultimately they need to be taught properly. You should have good teachings both at school level and also at the university level. Because once you have a malignancy, then it brings a lot of problems to the family. So that need to be curtailed. So this is one of the reasons.
Hassel, excellent question. The cancer incidence in each place is changing. Like Dr. Sree sir told, the esophageal cancers are very common in particular area. And if you look across India, you'll see very strange changes in incidence. For example, the gallbladder cancer is very common on the Gangetic bed. And look at stomach cancers. The stomach cancer is the most common cancer in Tamil Nadu, in males. But if you go to Kerala, stomach cancer is not among the 5 common cancers, except in North Kerala. So Tamil Nadu, according to the figures from last year, has diagnosed 96,500 cancers in Tamil Nadu. And the most common cancers in men are stomach cancer, followed by lung cancer, followed by oral cancer. Coming to females, the most common breast cancer, followed by cervical cancer, followed by ovarian cancer. So if you move to Kerala, it's different. So one thing is same everywhere, breast cancer. The breast cancer in women are increasing in a significant way. And even Tamil Nadu, every year 6% increase in cancers are happening. So why this is happening, we don't know. Maybe because of so many factors. The etiologies are different. So esophageal cancer, like Dr. Sree sir told, was caused by hot food, beverages, sometimes the food which directly affects the esophagus first. But if you ask me, which are the cancers to be worried about? Because India has a national cancer control program, and the program is aiming at mainly 3 cancers: oral, cervical and breast. Why? Because these cancers are causing significant morbidity. Almost 30% of morbidity is caused by these cancers. And these cancers are easily preventable. For example, the cervical cancer is caused by one virus, HPV virus. And if you cure the virus, there won't be any cancer. So it's very easy to control such diseases. So the common cancers which can be screened and targeted are oral, cervix and breast, and maybe colorectal, especially in Trivandrum. And Trivandrum as well as Kanyakumari is near to Trivandrum. Even Kanyakumari also, the colorectal cancer incidence is going up. So if you think about Kerala, the most common cancer in male are lung cancer, oral cancer, followed by colorectal cancer. It's different from Tamil Nadu. And female, it's again, it's also different. The breast cancer is most common. The second most common is gynecological cancers. Then comes thyroid cancers. So the cervical cancer is per se is much less in Kerala. So it's different everywhere. That's what we see, and it changes every year. Next year it may be different, and the exact etiology I think we need to study out.
Srijit sir, this question is for you. What is immunotherapy? I've heard that immunotherapy is a promising treatment for cancer in the future. So what do you think about that?
Yes, it is. See, the basic problem with chemotherapy is it does not differentiate between a normal and an abnormal cells. So it comes with a fair set of toxicities. And in the era of personalized medicine, you try to target a particular disease or a particular cell. For example, in patients with a non-Hodgkin's lymphoma, on the surface of every cell, you have what is known as a marker. We call that a cluster of differentiation markers. Example, CD20. So this CD20, in order to hit the CD20 positive cell, there is no need to give chemotherapy. You can give a monoclonal antibody. This monoclonal antibody, when injected, homes into the particular cell, latches onto it, and destroys its cell by using the immune system. This is the most simplified version. But in certain lymphomas, we have a tendency to add this along with chemotherapy. The reason is, once you give chemotherapy, some amount of cells do remain in the marrow. And these are the nidus of a future relapse. So in order to prevent that, you use this. This is an entirely different scenario. For example, I'm sure you might have heard of what is known as a CAR T-cell therapy. Have you? The answer is very simple. The theory is very simple. For example, you have got a lymphatic leukemia. And on the lymphatic leukemia, you may have a particular B-cell marker. And that is what is going to hit upon. And the leukemias, they proliferate at an alarming rate. And the patient is dead in no time. So what you do is, you harness your immune system for that. We take the particular antigen, and then you take your T cells, you send it to the lab, and you, using an adenovirus, you put the gene that is responsible for producing this particular antibody onto the T cell. Then you do what is known as an explant, where you multiply it. Right? Once you multiply it, so this T cell is now ready to be homed to the particular tumor. So it is then taken and given it to the patient. So all the T cells home to the particular marker bearing tumor cells and destroyed by antibody-dependent cell killer toxicity or many of these such mechanisms. It do comes with a price. You have CNS effects and what is known as a cytokine release. So how does this honorable cell kill it? You release a set of cytokines or anti-inflammatory molecules. So in addition to targeting the malignant cell, it also targets your lung and you land up with certain problems. But these are tackled. And the first patient who underwent was about 8 years or 9 years. Now it is almost 26 years and she is still alive. So we are moving on from what is known as a blanket treatment to personalized medicine. This is exactly what Jayakumar was speaking in the first shot. Right? Okay.
This question is to Dr. Jayakumar. Why do some cancers come back even after successful treatments?
Exactly. That is one important aspect of cancer. Cancer has a tendency to spread to different parts of the body. That's called metastasis. If you have a cancer in your buccal mucosa or in your lung, through your bloodstream or through your lymphatics, it spreads to the neighboring structures or to distant structures. You may be tackling only the local area, but the tumor cells are already started spreading to other parts of the body through your bloodstream or through your lymphatics. So if you are not tackling all these problems together, there is a tendency for it to come back. That is why we ask the cancer patients to see your doctor for a checkup at regular intervals and to check whether if it is coming or not. Similarly, for a person to get a cancer, there will be some external aspect which is acting on them, like some genetic changes. The same gene is acting again, even if you have cured that particular area, the same genetic changes is already in their body. That will again trigger to have the disease to other parts. Okay, and that is another reason. And the same environmental factors which have produced the original cancer is still there in that area. So these are some of the reasons. So one is the type of spreading of the type. That is a problem with the cancer. It doesn't stop with that particular area alone. It has a tendency to go to other parts of the body. It's called secondaries. That is one thing. So you have to tackle the primary organ plus the area where you have the secondary. Then the genetic factors which has contributed producing a particular cancer is still there in the body. So that also you have to tackle. And also the external environment which is there. Okay. Now we are facing another problem which is called a second malignancy. Now many cancers have become curable. So you have cured one area at particular time. After some years, another cancer in another area will come out. That's called a second cancer. So these are the problems which we are facing in recent years. So these are the reasons for coming back the cancer. Right. Okay, you understood?
Thank you. So this is a common question to all the doctors here. What is the most misunderstood aspect of chemotherapy, radiation therapy or surgery among patients?
Yeah, thank you for the question. And I think one of the most important unpopularity of surgery comes from the fact that surgical procedures are very painful and it involves big wounds and it involves chopping away important organs. But that era has long gone. Now, the cancer surgery is so sophisticated and advanced so that you can do many complex surgeries with minimal access, keyhole surgeries, so that there won't be any pain. And you see sometimes patient going after the next day of surgery, sometimes same day of surgery. And coming to the organ preservation. So earlier, the cancer surgery used to involve removal of the body parts which caused some organ dysfunction. For example, if you remove breast, the patient will be emotionally deprived. If you remove rectum, the patient has to have a bag for defecation. If you remove the urinary bladder, the patient used to have another bag for urination. So that also has gone. And coming to the limb surgeries, limb sarcomas, you have some sarcoma of the leg or bone tumor, then maybe 30 years back we used to amputate. Now things have changed with the advantage of technology, with the advantage of advances of the multimodality care. We are able to do minimal surgery at the same time preserving the organ functions and reducing mortality, morbidity and patient discomfort. So that is achieved. So the greatest myth about surgery is that surgery is painful, it will keep you in the hospital for a long time, it will cause organ loss. I think that has forgone long back. Now surgery is a advanced procedure where it's less pain, less invasive and patient goes home very fast.
I'm taking over from Chandramohan. So what Chandramohan was just trying to tell you is that we are moving in from mutilating surgeries to organ preservation and discharge from early discharge from hospitals. Chemotherapy is known for its toxicity rather than its effectiveness. That's because of the complications because it doesn't differentiate between normal and abnormal tissues. We are progressing from that. Because some chemotherapy will always be there. We do not have any other option other than that. And some people need to be treated with chemotherapy, and if you are properly trained and the patient is properly informed, they will be able to tackle this thing much earlier. Now we are moving from that to immunotherapy. Immunotherapy has minimum side effects. Because it has minimum side effects, that is found to be much more acceptable to the patient than others. First of all, there are a lot of people who give you all sorts of funny ideas regarding chemotherapy. It's not like that. Most of the chemotherapeutic agents which you are given do have some amount of toxicity, but most of the myths associated with it are just hearsay. And it's time we move away from that. Thank you.
Continuing from Dr. Srijit, I will tell you something about the radiotherapy. Most of the cancer patients need radiation treatment at some point of their treatment. So there are a lot of myths regarding radiation. It will produce a lot of harm to your normal tissue. It will produce blackening of your skin. It spreads to other parts of the body. And it will also affect the neighbor or person sitting next to you, it spreads to other persons also. These are all, it's nothing. We have the latest machine, the latest technology which is available, so that we can pinpoint our area of interest where radiation treatment is really needed, So there is something called the newer techniques of giving radiation like IMRT, IGRT, and so many new techniques are there. So we can really mark the area of interest where radiation is really required. It will not produce any skin changes like blackening of this thing. It will not produce any harm to the person. It will not affect the neighboring structures, because when we plan your radiation, you will also see that the normal structures which are near to that organ is also not included in your radiation field. We have newer modalities of treating this technique with radiation, and it will not spread to your other person who is sitting next to you. The point you stop your treatment from the radiation machine, it is not there. When the door is closed, there is no radiation to neighboring structures. So the myths of radiation is so important now that many people are reluctant to come to us for radiation. It is not so. There is no harm. It will give only to the affected area at the correct time which we specify. Okay, it will not other. There is another form of radiation which is called brachytherapy, where you put radioactive source or needles to that organ of interest. That will give radiation only to that particular area where it is really required. Other persons or other organ or other neighboring structures will not. So these are all myths. To sum up, to treat a cancer patient, you have to have surgery which is not at all mutilating. We have modern techniques are available, and also the surgeons will reconstruct the removed structures. So that is not there. And the side effects of chemotherapy is so much reduced, there is not much side effects. It's all preventable with the latest technology. With the immunotherapy, there is nothing. And also radiation, you can prevent almost 90% of the side effects. Maybe when during the treatment time or 1 month or 2 weeks, patient may have some local problem at that time, which will be tackled, which will be stopped within 1 or 2 weeks. So there is no myths of giving radiation to a particular patient, because it has become a totally curable disease. This has become a multimodality treatment. Cancer treatment has become a multimodality treatment where the surgeon, the radiation oncologist, the chemotherapy giving person all sit together, discuss, then only we treat. So it has become so curable now, So with the very less side effects, you can treat, cure, and make the patient happy, and they can go home. They will have a normal family life.
This is an excellent aspect actually, the misunderstood aspects of cancer management. Dr. Jaykumar said just now that when the patient leaves the radiation room, there's no more radiation to the patient. I deal with the type of radiation where the radiation is given into the patient to drink or as an injection. So when the patient leaves the room, he is still radioactive. Most important thing. Everybody knows this these days, so they are very, very badly scared about this. Take a common thing like thyroid cancer, we give very high doses of radioactive iodine. Patient is kept in the ward till it becomes acceptable, and then even then, at the time of discharge, patient will be carrying some amount of radioactivity all around. In his sweat, in his tears, in his saliva, everywhere, urine, everything will be radioactive. So this fear is there in the patient. Can I go home? You are discharging me, but can I go home? Should I stay for another day or two? should I stay for a week? Like that questions will come. I have a small child in the house. We tell them don't take the child or don't go near the child for 2 weeks. So most mothers find that impossible. The small kid will want to be with the mother, right? So that's a terrifying aspect for the mother, seeing the child but unable to touch it or unable even to sleep near the child. Suppose you go attend a function, important marriage or something like that, of that kind. Patient is radioactive. Nobody else is aware of that, remember. Only the patient knows that. Next to the patient may be sitting a lady who is with early pregnancy. The child, fetus, the embryo will get a lot of radiation. Because most of the radiation comes from here. So we have to tell them don't attend this kind of function, traveling in bus and all that. Avoid for 2 weeks or so. All of which makes a patient feel like an imprisonment. Nowadays, I have found it much more convenient thanks to COVID. Hard to believe that COVID can have a good effect. Now I have to tell the patient, imagine that you have COVID, take all the precautions like social distancing and all that, you keep, that's all. Previously it used to take hours of explanation. Another thing is, I told you, this patient is admitted in an isolation room. Many people, in fact one patient asked me, is it good to get admitted in an isolation room? I am told that it is a dark dungeon, like being put into the dungeon in the old days, closed, nobody can come there. That's not correct. Here actually we keep a patient in an open room. Only thing is the nurse stays a little distance away with a camera facing the patient, so we can know what's happening to the patient throughout the duration of the stay. We sometimes even allow the patient's bystander. Now, thanks to COVID, they stay 6 feet away. You can see the patient, ask how are you. Even when taking rounds, like regular doctors go near the patient and talk, I cannot do that. Because if I go near the patient, I get radiation every week. Patient gets it once in a lifetime only. So that is extremely dangerous. So this kind of misconceptions, which everybody is aware of these days, is important. The patient is a walking radioactive source, which is very different from the external radiation. Even Briggy and all that is external radiotherapy. Once that is removed, no more radiation from the patient. Here, patient remains radioactive for 2 or 3 weeks after discharge also. So this kind of things, now thanks to internet and Google and everything, everybody is aware of these things. So safety aspects of that. Say, can I have a child after this? The ovary gets irradiated, testis gets irradiated. So 1 year you have to wait. You cannot have a child immediately. Stay away from your child and next child after 1 year only minimum. So this kind of things people know also, but why 1 year? Why not 6 months? So that kind of questions also come up. We did a study on that in RCC, but I don't want to go into those technical details. But this is the kind of thing which you have to be very careful about with internal radiotherapy. Okay? This is a kind of internal radiotherapy, that is external radiotherapy. Thank you for asking that good question.
So we are class 12 students of Trimbika Vidya Mandir, and this interaction between the doctors was extremely fantastic and good. I feel like a doctor after knowing all this information. I would like to thank Dr. Mookambika 𝐼𝐕 and the principal, Mr. Ranjana S. Nair, and our class teacher, Savita B. Nair, for giving us this great opportunity to give an interaction with this doctor. So we are having this interaction because we've chosen cancer research and awareness for our Expo project, and I believe that this interaction was very much needed to get information about cancer for ourselves and all the people who are going to be viewing our Expo. And I would like to say a final thank you for this wonderful opportunity that you've given us, and you've taken time out of your critical schedule to give us your information. So thank you for that.
Thank you very much.